I used to do a lot of judo and karate when I was a kid, and my nose got broken quite a few times. And then as I got older, and I thought, no, not to like be one of the bold and beautiful and that, but I just thought I wanted to get it done, so.
3 years ago, Rita Payton decided to have cosmetic surgery on her nose.
Got a few different quotes from other surgeons, and then I ended up going to this particular surgeon because he'd only quoted just over £4,000.
Rita paid up front and had her operation just a few days later. But as soon as she came round from the anaesthetic, she knew something was seriously wrong.
Like my throat was blocked, I couldn't breathe out my nostrils, and I couldn't speak, couldn't shout out or nothing.
Rita took this picture of herself in the mirror.
I had like a hole in the tip of my nose. It was red, it was fleshy, and like 2 square sponges, really big, stuck out of my nose. It had gone really hard with blood. It was horrible.
Rita was discharged from the clinic, but soon went back for further treatment with the same surgeon. For the next 18 months, he gave her filler injections to try and repair the damage. But it hasn't worked, and the physical and mental scars of her surgery have had a huge impact on Rita's life.
I was studying to be a nurse, and I dropped out because you have to have a certain bedside manner. So if I was on the surgical ward, for instance, and I was telling the patient, fine, you're going to be okay, and then they saw my nose, they'd lose confidence.
Rita's clinic say they can't talk about specific patients, but say unfortunate outcomes can be caused by post-operative infections, although they say that their infection rates are very low. But that's not the case everywhere. According to a recent report on behalf of the Royal Colleges, the standards of cosmetic surgery clinics in the UK need to be improved.
The report reveals alarming numbers of private clinics are employing underskilled surgeons in poorly equipped operating theatres. And with up to 3/4 of clinics not properly regulated, it's feared that more and more people will be signing up to potentially dangerous and life-changing operations.
Bad practice does put patients at risk, there's no doubt about that. Any doctor can be a cosmetic surgeon at the moment. Anyone can try their hand at it, and that's ridiculous, and that just isn't safe.
In response to the report, the independent health regulator, the Care Quality Commission, has been given greater powers to regulate clinics. But there are concerns that this may not be enough to tackle bad practice in the cosmetic industry.
It's a multi-million-pound business. It needs regulation, it needs statutory regulation. A lot of the surgery is very complex. It's not appropriate for someone to walk in off the street, lie on a couch, have a major operation and walk out the door again. And that does appear to be happening.
Back in Merseyside, there's new hope for Rita. She's having another operation on her nose, which she hopes will bring an end to her cosmetic surgery nightmare.
So I'm just putting the lines where I will be cutting. This is along the previous line, I'm afraid I have to go along that.
It's a major operation, and surgeons will have to use cartilage from Rita's rib and ear to repair the damage.
Rita's treatment would have cost thousands of pounds if it was done in the private sector, but because she's got problems with her breathing now, the bill for today is being picked up by the NHS.
When it comes to life-threatening problems or functional problems, we are having to do more and more surgery. So obviously it's a burden. It takes away the resources from what we do normally, which is breast reconstructions after cancer surgery. Those are the patients where we should be focusing our resources on.
3 hours later and the operation to rebuild Rita's nose is over, and it's not been without difficulty.
When you opened Rita's nose up today, just how bad was the damage inside?
Everything was stuck together.
Yeah.
I can describe it like concrete. Just looking at it, there was missing cartilage on the right side of the nostril. The bit that holds the tip of the nose up had been removed.
It will be weeks before Rita knows whether her latest surgery has been a success. The consequences of her decision to go under the knife have been life-changing and highlight the importance of not rushing into cosmetic surgery.
Every procedure has significant risks, and you need to talk to the surgeon. You need to consider all the options available to you. Go away, think about it, do the research, and then making a decision. Is the end result worth going through all the risks?
Don't take it lightly.
Don't take it lightly.